Hey guys, Dr. Ben here, Functional Medicine Centers. Excited to talk to you today about Candida and yeast and what it is doing to your body. So welcome everybody. Love having you on. A lot of you have heard about Candida. A lot of you have heard about yeast, gut infections, bad bacteria, thrush in the mouth, all of these different things. And yet what is actually going on? What symptoms is it causing? And what can you do about this? So I'm going to get all into that today. I've got a link down below. We found a great little supplement holder on Amazon. We're going to start using these with patients. A lot of people are saying, hey, I have a hard time. If I'm taking stuff to kill off yeast and then I'm taking probiotics and all that, how do you separate those out? So we saw a cool one down below. You can check that out. So excited today to talk to you about this because so many of our patients have gut issues, and usually that Candida is coming from the gut, and we see this a lot of times in the tongue. Let's go over the 9 big symptoms that we look at for Candida infections. And so here we go. Candida or yeast overgrowth, fatigue, so a lot of people will be more tired. We'll have sweet cravings, so you'll be craving sweet things like, man, after dinner I want a sweet. Give me a thumbs up if any of you guys have any of these. It's very, very common. Hey, Jennifer down there in New Mexico, good to see you. So sweet cravings, we're going to be tired, you've got bad breath. It's kind of like you're brewing this yeast and some of this yucky in your stomach. And so if your spouse or any of your kids even, we see it a lot of times in kids, have chronic bad breath, it's usually a yeast, bad bacteria, gut imbalance in there as well. We're going to see brain fog. A lot of people get brain fog. They walk into a room, forget why they're going in there, all these different things. For those of you jumping on as well, what we're going to do today, I'm going to give away a probiotic. This is one of our favorite probiotics here, especially for Candida and yeast. If you guys comment down below or share our page, do both of those, comment and share our page, we will drop ship you this free probiotic. So we'll be talking about what you can do with that as well. Hey Hilda, good to see you. So here we go. Brain fog, hormones, joint pain. A lot of people has inflammation. They've got joint pain. We're going to have decreased sex drive, the chronic sinus issues. A lot of times if somebody's like, oh, I get 3 or 4 chronic sinus issues a year, that's usually some type of a yeast as well. Gas or bloating. This is the biggest one. There's a bunch of thumbs up coming in there. A lot of people are having these symptoms. So gas or bloating. This is number one that you got to look for. If you've got chronic gas or bloating, you're basically brewing beer. Hey Amanda, good to see you. You're brewing beer inside of your digestive tract. And so there's even a thing called auto intoxication, which people can actually get drunk off of what is going on inside of them. Hey Jennifer, great, thank you. So again, our favorite one, you can't even see it, we'll get you a link to that as well. But this Strengthia is one of the best probiotics that we've had that can help knock down some of those things, but I'll be telling you exactly what you need to be doing here in a second. So gas, bloating, you're going to be expanding. If you have to like unbutton your pants ever, or if it just feels like people are asking if you're pregnant way too much, any of you women out there, hopefully it's not any of you guys, but give me a thumbs up if that's any of you women out there that you're like, man, is somebody going to ask me if I'm pregnant today just because it feels so bloated? That's usually a gut issue that we've got to fix up. Decrease immune function. If you're getting sick all the time, that's usually more of that as well. And chronic urinary tract infections. A lot of people that have excess Candida are having these urinary tract infections. So what is Candida? Hey Mary, good to see you. What is Candida? Candida is a yeast, and it's the most common cause of the all of these issues like thrush, all these things. But unfortunately, Candida is actually evolving, and there's a new strain of Candida that we're seeing that is becoming anti-resistant, antibiotic, antifungal, all these things, and they're finding it in hospitals. It's becoming what they're calling a super bug. So Candida in and of itself is it is a very intense bug. It's really important. We need it in our digestive tract. It helps with absorption, a lot of things. And if it's in the good range, good balance, everything's going to be okay. But what happens, here's some 6 things that are going to knock it down. Antibiotics are going to knock down our good bacteria, then the yeast, the candida, the bad bacteria, all of those can go up. Hey Jennifer, good to see you. I always look 6 months pregnant. I need some of this, absolutely. And then IBSD, yeah, so that absolutely, candida, yeast, bad bacteria, this whole microbiome out of imbalance can absolutely cause some of this diarrhea as well there. Low ferritin. Hey Kay, with low ferritin, you've got to look at the gut as well, because you're usually, one, not absorbing, but two, you could also be losing blood in that digestive tract. You could have leaky gut, irritated gut lining, all of those things. So we've got to go through and get those things healed up. But here's what happens is the bad stuff gets up so high, and then the good stuff, even taking some probiotics is going to be helpful, but we have to kill off as well. And so that's with all of our patients. We'll do oil of oregano, garlic, all these different things, knock it down, and then bringing those up in there as well. So one of the big things is probiotics are helpful, but you've got to kill off bad stuff as well. So that's a big part of where that's coming from is antibiotics. If you've been on more than a couple rounds of antibiotics in your life and have not taken massive action with your gut microbiome, it is not in the good place. So that's a huge part of it. Then we look into birth control. If you aren't on birth control or have been on birth control, that throws off your microbiome as well. Is there a test for it besides showing symptoms? In the blood work, we look at different things as well. We'll look for elevated neutrophils. We'll look for eosinophils high. Both of those are going to be telling us about some leaky gut, about bad bacteria overgrowth in that gut lining as well. Unfortunately, stool tests aren't that great to be able to evaluate. Yes, it tells you what's coming out right at that moment, but not what's going on in the whole digestive tract. If you've been on oral steroids like prednisone and some of those things, it's thrown off your microbiome. If you've had cancer treatments, it's thrown off your microbiome. If you've got diabetes, type 1 or type 2, your microbiome is thrown off. If you've got pre-diabetes, it's probably there as well. If your blood sugar's swinging high and low, or if you're feeding it with excess sugar, with excess carbohydrates, grains, things like that, then it's probably out of balance as well. If you have a depleted immune system, if you're on immunosuppressants, anything like that, then your microbiome and your gut balance is off and you've got excess candida in there. So what we've got to do, and again, for anybody that's jumping on, comment and share on here, and we will be sending out a free, let me see if we can see a good picture of it, box of our favorite probiotic, 60 capsules. It's a 30 billion in each one of these. So, the probiotics do matter. There's certain types, and variety matters as well. And this is really important. We've got to not only, okay, here's a good probiotic, but you need to be taking multi-types. So when you run out of one bottle, get a different type, get a different type, get a different type. So over and over and over, you want to be getting those. Hey Sharon, good to see you there. And Jamie, yep, absolutely. These are some of the best ones. So great to see you on there, Jamie. All right, so what do you do? Well, the first part you got to do is that anti-candida diet. What does that mean? Keep the sugar, keep the starches, keep the grains to a minimum. Some people are like, you can't even eat any fruit. For our patients, we look at it as, hey, if your blood sugar is going to be okay with a certain piece of fruit, it's probably going to be okay to eat that. So you want to get the carbs, starches, the sugars as low as possible. If you stick your tongue out and you see white coating on that tongue, you need to take massive action. You need to start taking probiotics, kill off the bad stuff. You need to change your diet, and your gut is going to thank you for this long term. So look for all those symptoms, and we're going to see some major changes in here. So the Candida diet that we're going to talk about is just keeping the carbs, starches, sugars, sweet teas, all of those things down. And then you want to add more things like garlic and oregano and herbs, different into your diet. Not just supplements, but even into your diet are going to be helpful as well. And then you want to make sure that you are taking probiotics on a regular basis. You can take some kombucha, you can do some yogurt if you can't do dairy. Coconut yogurt's great, almond yogurt, those things. You can do kimchi, sauerkraut. Any of these fermented vegetables are going to have a lot of good bacteria for your gut. So as you're killing off, you need to be rebuilding that back up and adding in the good things in there as well. So Candida, a lot of the fatigue, white tongue, brain fog, immune system down, that gas or bloating that you look like you're pregnant, all of those symptoms, big sign of Candida or yeast. If you've got that, it's going to be contributing to a lot of other health issues, decreasing your immune system, all types of different things, probably coming from your antibiotics, could be birth control if you've got blood sugar imbalances, if you've been on prednisone, any of those things. So, you've got to take massive action today. It all starts with what you're eating. More than anything out there is your diet, and you've got to take massive action on that. So again, if you guys haven't already, comment or share below, and we will send you one of my favorite probiotics. We'll drop ship that to you wherever you guys live. We have patients all over the country, all over the world. So if you live in England and we pick you, I'm not sure how we'll get that to you. We haven't shipped over to Europe yet, but we'll give it a shot. So we love having you on. If you've got any questions at all, pop those down below, and especially if you know anybody dealing with gut issues, if they're on the toilet. We've had people 30 times a day, we've had people constipated, only going once a week, gas, bloating, all these different things. And it's a huge part of the process is to start in the gut, start rebuilding, start killing off, start growing that good bacteria back in. All of these things you've got to go through and do those steps over and over and over. But if you've got Candida at all, start on your diet. Start with only eating the things that you know are going to be constructive and not feeding that Candida as well. So love having you guys on, and we'll link some things down below as well. Great seeing you guys. If you've got any questions at all, go ahead and drop down in the comments any questions, anything. If you need more support, need more help in your gut, get a hold of our Phoenix, Nashville, or Fort Collins office, and we can help you guys get your gut back to normal. Take care.